Patients often ask us why their MD referred them to us. After all, their dentist can also make oral appliances. We usually explain that even though any dentist is capable of taking impressions, sending them to labs, and inserting oral appliances, we have a lot of experience with sleep medicine and a technique for dealing with even the most difficult cases.
I notice how sleep apnea and byproduct of its snoring negatively affect the dynamic of the marriage and relationship. It's tragic when people have to move to different bedrooms due to the constant sleep interruption.
My journey started probably 2 years ago when I had open heart surgery. It culminated with a trip to a local hospital here in Passaic, New Jersey for 5 days, where I was diagnosed with congestive heart failure, with basically what I had when I back to my own PC. He had told me that I had sleep apnea and I should be tested. Well, I had went to a reputable doctor. He did the procedures correctly and so forth. He was very professional, and he set me up with a CPAP, which I had tried for 2 months, but I couldn't tolerate it. I would wake up at night and it would be on the floor. Out of desperation, I had found Dr. Sokolina. She got me set up with an oral mouthpiece, and she found her to be very professional, very caring. I've had the oral appliance now approximately 4 months, and I'm sleeping pretty well, and I have 100% compliance. My blood pressures went down, my heart arrhythmia has corrected itself basically, and I'm in pretty good shape. I communicate better with people. Now I sleep, and I feel that I'm going into REM because now I'm even starting to dream.
We have been board certified by the American Academy of Dental Sleep Medicine, and our office is accredited. That means that our treatment complies with the standards of the American Academy of Sleep Medicine. Over many years of practicing sleep medicine, we have successfully treated many patients and addressed many complications and challenges that have accompanied the treatment. Our treatment consists of several steps. First, we select an appliance design based on the patient's anatomical features and their medical and dental history. However, our treatment does not end the moment the patient gets their appliance. Next, we modify the treatment based on how well the symptoms disappear. After subjective symptoms like tiredness, bathroom visits, and snoring disappear, we refer the patient back to their original doctor for evaluation and testing. The success of oral appliances is 54%, but with home sleep test evaluation, we can increase the success to 65%. With titration during a lab sleep study, the odds for success increase to 95%. Even if during the sleep test, apneic events are still present, we have specially trained sleep technicians who can adjust the appliance. Finally, after the sleep test, we have another meeting to discuss results and rationalize the therapy if the apneic events are still present. Following our meeting, we monitor treatment results every year. A lot of people ask me if they can use appliances from Amazon or a pharmacy. According to scientific research, those devices do not provide the same results as custom-made due to their poor fit with the patients. It is very hard to obtain the maximum medical improvement without medical professionals or sleep testing. This treatment, like every other, has side effects and can lead to problems with temporomandibular joints and changing position of teeth. Without professional help and monitoring, the side effects can lead to serious complications. The only benefit to patients from those appliances is to experience the feeling to have something in their mouth during the night.
Hi, my name is Jenny. I'm the medical admin and biller here. I had the pleasure to meet with Dr. Sokolina. Her spark and excitement had brought enthusiastic to help treat patients with sleep apnea. I am here to help answer questions for all the patient about their concern with their medical coverage. I am here to help maximize your coverage for all your treatment and appliance. All questions and concerns are addressed prior to you proceeding with the procedures. I love the fact that there are other resources out there that can help maximize patient health.
To improve the outcome of my treatment, I work in conjunction with the specialists from a different area: ENT, pulmonologist, neurologist, orthodontics, weight loss specialist, and cardiologist. Sleep apnea affects children as well as the adults. In our office, we carefully monitor growth and development of jaws and facial structure to prevent occurrence of sleep apnea for children when they become adults.
Sleep apnea can affect any gender, and it is unrelated to either age or race. Also, even though the classical stereotype of a sleep apnea patient is someone who is overweight, in reality, 50% of my patients are slender.
Sleep apnea causes lack of energy. Many patients complain on being constantly tired and have no motivation to do anything around the house. After the treatment, this attitude radically changed, and that makes me very satisfied with my work.
It's only my third week, and I am very impressed with last night's results, as I said earlier, which was like no loud snoring at all, and 88% quiet sleep or quiet snoring, which is very, very helpful to me.
It has become the standard for drivers to get tested for sleep apnea and undergo treatment for it. According to the transportation industry's standard of care, drivers need compliance monitoring along with their treatment. Therefore, we provide monitoring by chip embedded in OA, just like the technology found in a CPAP machine. The reports can be faxed or emailed to a medical examiner's office.
And I feel very happy when after the treatment they mentioned to me, by the way, now I move back to my bedroom.